I saw what truly taking care of yourself means. And that's when my mindset as a dietitian changed. Being healthy, it's not all the time being in a smaller number and just focusing on that one aspect of what health is.
Welcome to Talkin' Shit, the podcast where we get real about the unfiltered truths women face in the quest for perfection. I'm Jana, your host, a dietitian and fellow woman navigating the pressure to have it all together, the perfect body, career, relationships, and making it all look effortless. Who set that standard anyway? Here, we're calling out the diet fads, hustle culture, beauty standards, and everything else that keeps us feeling stuck. But we're not just venting, we're diving into how to break free and rewrite the rules on your terms. So, grab a coffee or a glass of wine and let's talk some shit. Together, we'll uncover how to live a life that's unapologetically yours. This is Talkin' Shit. Let's dive in. Hey friend, quick question before we dive into today's episode. Does dinner stress you out more than it should? Because if you're like most women I talk to, figuring out what to make every single night feels like another full-time job. So if you're tired of the daily what's for dinner stress, I've got something just for you. I've created the What's for Dinner guide with 50 quick, healthy, and blood sugar friendly recipes that are perfect whether you're cooking for yourself or your whole family. No more second guessing, no more last minute takeout, just real food made simple. Grab your copy for just $9, click the link in the show notes, and make dinner the easiest part of your day. All right, now I'm back to the episode. But seriously, don't wait. Your weeknight sanity will thank you. All right, everyone, welcome back to the Talkin' Shit podcast. I have another fellow dietitian with me. This is a series that we're doing on dietitians. We're really just sharing our expertise and also stories of how we got into this space and why we advocate for patients the way that we do. And today I have a really powerful story with Lisandra. She's going to share her story, but also how she works with her patients and why it's so critical to receive preventative care. So thank you so much for being here. I'm really excited to be able to advocate in this way and to give you space to share your story because it's a really amazing one. So I will open it up to you.
Thank you for having me in your podcast, and thank you for giving me the opportunity to share my story. My name is Lisandra Cruz. I was born in Puerto Rico. Currently, I live in the state of Florida, and I moved here in 2016 looking for a better opportunity education-wise for my son. I have been a dietitian since 2011, so it's been a couple of years, more than 10 years. Initially, I started working in a hospital setting, and I was working ever since I got out of internship in hospital. Didn't specialize in a area specifically. I was just around the whole hospital. And until 2016, 17, that's when I started working inpatient, outpatient setting when I moved to Florida. And it was more on the weight management aspect. So I worked at a hospital that is called Orlando Health, and they had a partnership with the YMCA. And that's where I started getting more experience when it comes to weight management. And back then, my mentality was totally different of how I see the profession now. Back then, my mentality was, yes, weight loss, diet, calorie restriction. It was that type of mentality on when we talk about diets and working with a dietitian. Then many years forward, what got me here today to share my story is I was still working in a hospital, and after COVID hit, I thought, hey, it will be fun to do my own private practice, but I never took it seriously. It was just like, oh, if a client lands, that's fine, because that's not my purpose. It's more private. I mean, it's clinical, not private practice. So I had my side job, which is Lisandra Cruz Nutrition. But back then it was called Eat Smart. It was something totally different than that. I even back then I'm like, that sounds catchy. I don't know what this means. This doesn't have like a soul. It's just that that's what I wanted at that time.
Yeah.
So that's how my business started, my private practice. And on 2023, um, I I was like I was still working in a hospital setting, and I got in a car accident. Funny thing is, this car accident, I was standing still. My car was not moving. The lady behind me, apparently the foot got off the brake. And she said, I don't know what happened. I'm like, okay, it is what it is. We got into this. Next day after that car accident, I got laid off of my job at that time. And I'm like, okay, so now what I do? And I'm like, I have this side business that I was procrastinating on getting out there because I had my safe job in a hospital. And I'm like, okay, so I started like looking for a job, and I'm starting making like lifestyle changes. I started eating more at home and moving more, and I'm seeing like this drastic weight loss. And I'm like, wow, this is working. Like everything that I say to my clients, it does work. Like your stress levels are down and you get your weight loss. I'm like, yes, fantastic. I am able to tell that this works because it's working for me. The thing is that it's Lisandra on the outside, what I showed on social media, trying to attract clients. On the backside, Lisandra, I am experiencing symptoms of like constant cough, but then take into consideration that it was COVID, like it was around where COVID was still high risk in the area that I lived, and or the flu because it was summer. I'm like, well, I'm having a cough, and I just brush it off because that's all I did. I took care of everybody else except me. I was fine. Then I had some itchiness on my legs, and I'm like, well, maybe it's dry skin. I always try to find a like reasoning to that, those symptoms. And this is besides the weight loss. And as part of the treatment for the accident, because I was starting to get it adjusted by a chiropractor, he says, Lisandra, we got to do an MRI just to make sure that everything is okay. And in October, when that happened, that MRI came back with something on my chest. And I'm like, okay. And he is like, oh, don't worry. Maybe it's nothing. He was trying to like, it's okay. Let's just try to do some further studies just to make sure that it's nothing. Probably it's nothing. The thing is that multiple studies after, and MRI and PET scans and CT scans and everything, because it's MRI, CT scan. They should have done an X-ray. They didn't, and did a PET scan. It turned out that it was cancer, and I got the diagnosis of Hodgkin lymphoma in December 2023. And that is when my whole world changed, and my whole perception of healthcare and how I saw what truly taking care of yourself means. And that's when my mindset as a dietitian changed. That being healthy, even though we know it, but because of that culture, it is still engraved on our hard drive. Being healthy, it's not all the time being in a smaller number and just focusing on that one aspect of what health is. And that is how I am here.
Yeah. Well, I mean, a few things really stand out to me that I think a lot of individuals, probably particularly women, resonate with, is that idea of you were taking care of everyone else and put yourself last.
Mm-hmm.
Can you tell me more about how your mindset has shifted since the diagnosis, and since, just for everyone to know, you are clear of cancer at this time?
Yes.
Yes. So treatment was very successful and you're doing well. But yeah, tell me a little bit more about that mindset shift into like how do you take care of yourself now?
So so you guys can understand a little bit more about when I say I take care of everyone else. My son has special needs. So ever since he was a baby, he required, he's a teenager now, but he required a lot of therapy, doctor's appointment, and that incurred in I don't have time for myself because I'm tired.
Mm.
And I don't want to go out and work out because I'm tired. I need to look for something quick to cook. And probably it was not the most balanced meal, but it was because I only had maybe 30 minutes to cook. There was something else that I put aside because I needed to feel the need of another person. Now, with everything that happened during these past 2 years, the care it's on me. So if not only on how to feel my body better, because believe it or not, even being dietitian, there's so many things that we have to learn besides our specialty. And because I am a oncologist patient, now I had to learn how food can interact with chemo during treatment, how it can affect it, and then how I can get the most nutrients in my body when I'm not able to eat or I feel tired and I don't want to cook. Now that I'm free of disease, is like how can I feed myself better in order to reduce the risk of getting other cancers? Because going through treatment, you're getting cured of one cancer, but being put at risk of getting two other cancers, at least in my case, 30, 40 years from now. So what interventions do I have to put in food wise in order for that to prevent that from happening, at least on a nutrition standpoint? Now, for me, is a non-negotiable having to go out to work out. So I always go out if the weather permits to go out for a walk. I'm starting to do strength training because it has been proven that strength training helps kill cancer cells and prevent the development of cancer cells. So instead of if I have time, it's now I have to do time because I don't want to go through this again in the future. Now, sleep is a priority. Before, if I was able to sleep 5 hours, 6 hours, or I had very poor sleep quality for sure, now I try to make it a priority. Even though probably not every day looks perfect sleep wise, but at least I make sure that I get 7 good hours. And if not, I mean, there's so many other things that can affect my sleep quality because my mind keeps running at night. But I try to look for tools to help me get that better. So the way that I see life now when it comes to taking care of myself is I don't have a choice because I want to live. I don't want to go through this again because I already know how it is. Now, how do I bring this to my clients is I hope that you can put the tools that I'm giving you to work so you don't have to go through what I went through. Not necessarily the same type of cancer. I'm not saying cancer per se, but how can you make your life healthier so you don't develop any diseases or comorbidities that you have to live with, and then you will have to make the changes regardless.
Mhm. Yeah.
Yeah.
You mentioned, I think before we started recording that
Mhm.
it also changed how you um experience like receiving information. Like you said, you got the diagnosis and anything after that was just blank. You didn't hear anything else. And like how that changes the recommendations that you give to clients too is especially if they're going through a lot of different things or they have a new diagnosis. There's so many things happening mentally, emotionally, spiritually, even outside of that diagnosis that could impact someone being able to implement the recommendation. So how is that in your experience?
So be, when you hear a news that you never expect to hear in your life, like, hey, you have cancer. Oh, but you have the good cancer. I'm like, I don't care if it's the good cancer, it's cancer, whatever, regardless of how you like sell it to me. That moment you shut down. And as health professionals, because they have to do their job, and it goes the same way with us as dietitians, we have to get the information out there. And because the professionals that talk to me, they have to tell me all this information in 30 minutes. I didn't hear absolutely anything that they were saying. Thankfully, every time that I went to a doctor's appointment, I always brought someone with me because I knew what that happened. And sometimes they will say, so do you have any questions? Do you understand? And I'm like, yes, but no, not really, because there's so many things going on that it is hard to process.
Yeah.
How that changed my perspective with how I coach clients and how I work with them is that before I would like throw out all out there of what they need to change based on the interview that I had initially with them. And I know that that can be overwhelming. So that's how I changed my coaching style. It's like, okay, so this is what I see, but what do you want to work on? What do you hear that you want to work on? What are you willing to make a change now? Because some of them, they have a lot of more things going on than just coming to me and saying, Lisandra, I want you to help me lose weight. There's something always. There's a story on the back end that leads them to that. So I really don't know, because initially they don't open up to you unless you get to build that rapport with them. But sometimes they don't come back, and it's not because they don't want to, it's because they got overwhelmed. And I learned that before all of this happened, that's something that I used to do. And because I experienced it myself, I'm like, no, I cannot be doing this with my clients, because probably I'm going to be the one that they're like, no, this is too much for me to change.
Yeah, I never say there's unexplained weight gain or loss. And there's never any small goal. Like 1, 2 goals max, if that can be worked on. It's not like, for example, it's not just eat healthier, right? Like have more fruits and vegetables. Well, if we really think about how that has to come to play, like you have to go grocery shopping, you have to select the food that you want, you have to have access to that food, you have to know what you're going to make with that food, right? Like there's all these smaller, and I'm air quoting this for people that are listening, tasks that have to be done for that one goal to happen. So there's never any small goal that's usually set. And if we do more than 2, sometimes 3, it just depends on the readiness of change, then it's too overwhelming. It's like, no, I just don't know what to, I'm back to square 0 or square 1, whatever the saying is. And I don't know what to do. I'm overwhelmed. So I just throw my hands up and I don't do anything.
That's what happens with most of them.
I also think it's really what you highlighted as far as bringing someone with you. I think that that's really advantageous for most people when they see a doctor or any healthcare professional, because it can be really nerve-wracking to go in and have a conversation, or even like think about certain things, or even notice certain things about yourself. And so that other person can also be ideally a support, but also can hear things in a different way that maybe you didn't catch, or maybe they didn't catch something. So it can be a really good combo.
Yes. And that's why when I have clients that they seem overwhelmed, I ask them, hey, for the next session, would you have XYZ join us? And maybe that way that person can help you. Because it can be overwhelming. And when they sit there and I provide them the information, they're like, oh, I didn't know that I have to put this much work on eating better. I thought that you were going to give me a menu. And I'm like, no, No, Manny, I want you to learn to eat. And that's when I say, hey, how is your support system? It's so important to have a good support system, regardless of the situations that people go through life, because it's very hard to go through a situation by yourself. It is very challenging because if you're, let's say, if you're okay physically, but mentally you're struggling, how can you get through your day by yourself when you're struggling with your own thoughts? It's very hard. And if physically it's hard, for example, on my case, sometimes it was hard for me to get out of bed, where I would just lay in the couch because the level of fatigue that someone with cancer experience, it's to another level. You cannot get out of bed. You cannot walk. If you walk, you have to sit down or stop to catch your breath. So that's where the support system comes in. Even if it's friends or family, I will suggest anyone that's going through anything to have someone that they can rely on, that they can assist and be a set of ears when they cannot hear or listen for whatever reason.
Yeah. So, and I think we connected on this event, but I recently was at a Leukemia Lymphoma Society event, and they brought in, well, there was like 4 dietitians, and it was a community event, so it was open to anyone that was even that was a patient or a family member or friend or whatnot. And we did a quick presentation on the role of nutrition, and so many people after said, I've never met with a dietitian. Was that your experience as well? Yeah.
I, like I said, weight management, it was my expertise. And I knew dietitians that were, she was an oncology dietitian in the hospital that I used to work with. But when it was me as a patient, the center that I went to, they didn't have any oncology dietitians. And the message that I got was, you can eat whatever you want. And I'm like, no, I don't think that that's how it works. Oh, you're going to feel so bad that even if you can get anything, it doesn't matter what it is. I just want you to eat. Mm-hmm. And I went to another hospital after the cancer progressed. I was sent to the main hospital, and they did have a dietitian, but it was a one-time meeting, and that was it. And then I saw her again because I did get a bone marrow transplant, and that it's totally different. That's a totally different approach because you get all the side effects from the chemo before the bone marrow transplant that makes it very challenging for you to eat during that process. But I saw her once, and she's like, oh, but you're a dietitian, you understand it. And I'm like, but this is not my forte. I need you. And I have all these questions. Can I get probiotics? Can I get fibers? Can I get prebiotics? Because normally someone that has a healthy gut can get it, but I couldn't. And I'm like, okay, so when can I start it? Oh, not yet, not yet. I'm like, but I need to have that information. So it was kind of challenging that she was there, but she was not accessible. And that's when I said, you know what? To get oncology certified, I have to get experience and that's my long-term goal. I would love to become an oncology dietitian because I experienced the other side of it. And there's not many, at least in the area that I live. But in the meantime, I would like for people to not, when they come to me, it's like, oh, it's not only for weight management, because that's what the truth is that people look for dietitians for weight management unless they get a diagnosis of diabetes or that their lipid panel is altered. But when they come to me, it's like, yeah, let me just make sure that I get healthy overall, and then everything else is going to fall into place. When we are needed, there's not many of us. And then we are accessible through telehealth, through virtual coaching. But in my experience as a cancer patient, when I needed it, it was very hard to get in touch with one. And I eventually did with the Leukemia Lymphoma Association, but it was a phone interview, 20 minutes, and I couldn't get enough. She sent me a book home, and that was it. So yes, it is. And they don't, I mean, doctors unfortunately don't recommend seeing a dietitian unless it comes to the point that they have like feeding tubes, peg tubes, that then we are, or at least they feel that that's when we are necessary.
Yeah. What would you say from that prevention lens? Because I know prevention is big for you.
Mm-hmm.
Someone that is concerned, say they have cancer that runs in their family, what advice would you give them from preventative lens?
The first thing, get tested. Do If let's say they have breast cancer history in family, get the gene blood work to see if you got the BRCA gene. If not, get mammographies done. I'm getting mine done because I am at a higher risk of getting breast cancer. But if you know that you have it in your family, don't wait until you're 50 or 60 to start getting tested. I recently had someone that I know close to me passed away within a 10-day period. And she passed away from stage 4 breast cancer. And it was everywhere, and it was too late when it was found out. And she was 30. So it's not really the age where we will get routine mammogram. So I'm like, no, I have that. Those are the things, like, I know guidelines wise, there's certain age ranges, but if it's something that even if your health insurance doesn't cover, and you can pay out of pocket, do it. Do your colorectal screening. So do your colonoscopy. We know, and a lot of people, probably you guys have seen that there's a rise in the numbers of people that have colon cancer, young population, and it all becomes on lifestyle. Now people are more sedentary because foods are readily accessible out there. People get a lot of processed product out of convenience, out of lack of time for preparing meals. I've heard that like this new generation, it's steering away from alcoholic consumption, but alcohol, it's one of the most one of the most common things that people consume, that they increase the risk of cancer, colon cancer. There's also some research on breast cancer, and there is really no safe amount. So it's just being proactive, doing your studies, get tested if you can get tested, and just move. Like exercise, it's a big part of prevention for getting cancer. Not all cancers, because some of them you don't have control over, like blood cancers, but they do definitely reduce the risk. And eating well, it's not eating healthy, it's eating balanced meal, making sure that you got your fiber intake. Our diet, it's very poor in fiber because we are not encouraged to eat fruits and vegetables. So it's doing what people and dietitians, we always say, for your vegetables, your fiber, your fruits, move, sleep, manage your stress, but actually doing it. Don't think that it's not going to happen to me because I am too young for that to happen.
And I think this gives a different level of motivation for just healthy or healthful practices. Because some of the things that I see, like in my coaching clients, they'll say, like, well, I'm just doing this so I can lose the weight. And then I ask them, well, what do you do once you lose the weight? Because that's really the maintenance part. And these practices, so there's a difference between losing weight and focusing in on your health. They're different buckets. what I hear you saying is that we want to do these practices because it actually supports your health and can prevent disease. We know that it can prevent disease or at least delay it,
Mm.
and reduce the severity of it as well. And so this is where that lens, instead of saying, oh, well, I go exercise because I want to lose 2 pounds. Well, that can be great motivation. But once you lose the 2 pounds, what's your motivation? We want to keep you active in these lifestyle modalities so that you can live a really healthy and long life.
Yes.
Yeah. That's a very different lens and very different level of motivation for that.
Yes, it is. And that's why, and sometimes even to my clients, they tell me, and I try not to bring up my story because it's not about me. But when it's hard for, I mean, I always tell them, hey, peel the onion. Let's go deeper. Why? And they just look at me and they don't have a response. I'm like, but why are you looking to lose weight? And people that, for our listeners, there's always going to be something that it's deeper than I just want to lose 20 pounds. I just want to do why 20? First, why 20?
Yeah.
Because the BMI says it, because there's a list or your doctor says that you got to do why 20? Maybe because, not everyone, maybe you will feel good or look good at 120, but how would you feel? Why that number? But why do you want to lose weight initially? And then some people start like, oh, you know what? I have kids. I want to be there for my kids. They're growing up. I want to be able to run around with them, not get short of breath. And I'm like, okay, now we're talking. So now it's not just superficial of, oh, I just want to look good. I'm like, there's always going to be something else. Um, and then when I don't see that they get to that why, they just keep it on the upper level, the outer skin of the onion. I tell them my story, and I'm like, hey, and I was I'm Latina, so I have my curves, or had my curves because I lost them. But I tell them, you know what? I was in a adequate weight. I liked how I looked, but on the inside, I was not really healthy. I was not in good health. So, what's the point of me being on a number or look in a certain way because society states that we have to look a certain way? But why not change that mindset that, you know what, I want to look like this, but yeah, I want to see myself like that, but I want to be healthy. I want to have a good blood work. I want to have good glucose control. I don't want to develop prediabetes because I know that that runs in my family. Um, I want to have good behaviors because I have kids and I want my kids to model what I'm doing. So trying to dig a little bit deeper. And that's when they're like, oh, thinking now that way, then I will like. And then that's when they start looking into a more deeper why than just, I just want to be skinny.
Yeah.
Yeah.
Yeah. I share this often in my own story. When I was my lowest weight was when I was my most unhealthy. And so it's always interesting, right? Like I love that you highlight that, is it's really the number on the scale means something, but it doesn't mean everything. And it really doesn't tell us much about what is truly happening. And so someone could be 10 pounds above the BMI and they could be at the healthiest they've ever been. And so that's really just very relative. And I think that's something that we as dietitians do take a look at, is what's the full picture? Like, how are you doing from your energy, your sleep, like you said, your metabolic profile, like cardiovascularly, like how are you active? Like all these things matter so much more than, say, that specific number on the scale. So
Yes.
it's definitely, yeah, it's very, yeah. It also got me thinking, like, one of my people ask, why do I do what I do? Or like, how do I keep doing that? And I lost my dad at 59. He died from, heart failure, but uncontrolled diabetes and obesity. And so it was always one of those things, like it's still to this day is one of those things that I think about, like when I'm working with clients, one, just the level of understanding of how much they are struggling. But two, like why I want to be a representation of what health can look like, to show people that it can be done. But maybe we need to do it in a different way because how it's been done in the past, like doesn't work for most people. And we see that because of the numbers, right? Like we
Yeah.
have the highest rates of heart disease. We have the highest rates of diabetes, highest rates of obesity. So something's not working. So maybe, just maybe, we need to shift some things and look at it a little bit different. And I think that's exactly what you're saying is we got to look at it not just the number on the scale, not just weight loss, not just weight management. It's really your health as a whole that we're taking into consideration. And
Mhm.
that really does shift everything.
It does, especially since, and it is important to highlight that when they understand that, because they set sometimes a goal, oh, I just want to work with you 1 month. And I'm like, why? Because they think that they're going to achieve all the changes in a short period of time. And that's something that I asked them, how about we work together for a while? I mean, there's so many things that goes on in people's life that can affect the way that they eat. And again, they just want the quick fix. They come to us, it's like, oh, I want the quick fix, give me a menu again. And it is like, let's work long term. There's always something to improve. There's always room for improvement, from growth, from learning, from a nutrition standpoint. And if we look at as a preventive care standpoint, they can meet a goal now. But then what about if you want to, I don't know, start running a marathon? Now that is another goal that the intervention is going to be totally different from what initially was your goal of weight loss. So I think that our work is very important, not only like in one phase in people's life. It should be something that, like the doctors, they see the doctor every year for the rest of their life if they have like good um, scheduling on their physicals and their animals, and the women see their OB/GYN. I think that it should be the same thing with dietitians, um, because our bodies are not the same through lifespan. Now I'm seeing, I'm getting a lot of women on perimenopause and menopause that I didn't see like 3 or 4 years ago. And I'm like, okay, now I'm going into a different niche, different clients with different needs. So that's why I think it is very important for us to be part of everyone's healthcare besides their doctors and the OB/GYNs and the dentist, especially from a preventive care standpoint.
Yeah. And so it's a theme recorded with another dietitian before you, I mentioned, and we talked about meal plans. And so this is a theme. If you're tuning into this podcast, it's not that we don't want to give you meal plans. It's just that clinically we know they don't work. Usually most people will follow them for max 3 days and then they're back to the plan. And so we want to be able to support you far longer than 3 days because that's where a true transformation comes from. So now we're not picking on meal plans, but they just don't work. And so why would we do something that we know doesn't work?
Exactly. I still hand them out.
Yeah.
I tell I
Yeah.
tell them, you know what, this is a blueprint. I just want you to have an idea and a taste on how it would look like.
Yes.
But at the end of the day, I tell them, I want you to think it this way. What will happen if we stop working tomorrow?
Mm-hmm.
Are you able to continue implementing those lifestyle changes because you learn how to do it, or were you just working with me for a mere menu? And then what happened? So you're going to go back to doing what you were doing because you don't know what to do moving forward.
Yeah.
So,
Yeah.
mm-hmm.
Well, I'm so thankful that you shared your story. And unfortunately, Unfortunately, or maybe not unfortunately, I do believe this is God's plan and that we all experience things in our life that can serve or are meant to serve other people. And I think that's exactly what you have done with sharing your story and continuing to advocate for clients everywhere. So I really thank you, and thank you for allowing us to be part of that story as well. I really appreciate it.
Thank you, Jana. Thank you for having me here.